Okay, so we're here to present our book, The Principles of One Health for a Better Planet. But in order to do that, we need to present a little bit of who we are. And you have a fantastic chance today to meet four authors of the book, two editors of the book, one chair and one co-chair of Network for EcoHealth and One Health, all in one place. And these are all fantastic ladies, including me, of course. And yeah, we are genderly very much balanced today, as I can see. I mean, in total. So we have a few guys to balance our gender here. So let's start. I think we have given enough time to everybody to join. So we will share the presentation and start presenting. Please, during our presentations, feel free to put anything in the chat that either you want to ask, comment, or whatever. And then after all three speakers are done, we will ask your questions. Also, feel free to raise your hand in any moment if you want to ask something, comment, add, or whatever. We know most of you, so we are like a happy family. But anyway, let me remind you of what was the root of this book, how it all happened. We all come from a Network for EcoHealth and One Health, which started as a cost action, then we transferred to a European organization, and at the moment we are an international organization admitting everybody who wants to join our group and who believes in One Health and EcoHealth. Therefore, we have our website, which has a lot of interesting information. The most interesting is the one that you can join us by a membership form. And since January 26th, we will have some membership fees, which are not high, which are really manageable for the majority of us. And therefore, please feel free to go to our website and check out what is there. You can find there some of our publications, some of our recent work, all the links for the book and other stuff. Network for EcoHealth and One Health, as I said, started as a cost action. And then when that project ended, we formed our little association, which is at the moment still related to EcoHealth International as a European chapter. But as I already said, we became an international organization over time. The idea of the book came from the second speaker that you will hear today. And she was like, why don't we write a book? I teach my students and I always have a problem what to teach. We don't have books, so on. Let's write a book. So we did 4 years later. But it took time, 5 years later, sorry. It took time. It took 3 editors, over 70 authors, and like we said, 5 years to come with this masterpiece, as we like to say it. So yes, there are, of course, this. Pay attention to the chat because you will find interesting information in the chat. And then the book is meant to be an interactive one. You will hear from all the speakers how it works. It's interactive. You have tasks. You need to turn your brain on. You need to look into the different situation cases and so on, so that you really engage actively into our book. Book is free. Book is free to download in the PDF version. You can download chapter by chapter. Probably Gabby will put the link in the chat, but you will have it all over during the presentations. And therefore, you can enjoy the book. Either you can download everything or one by one, it's your choice. And read it for totally free. You can share it, you can keep it, whatever. You can also buy the book as a real book, but that costs. You can see on the CABI website, CABI, CABI is our publisher. You can also buy the book as a real book. And so you have many options. Not to waste any more your time, let's go to the second slide, Asta, please.
I try. Oh, no.
Yeah, perfect. Okay. So today we will talk about policy and governance, and you will hear about that from our Gabby. Gabby is the chair of Network for EcoHealth and One Health. Then you will hear something from Asta about One Health and the Sustainable Development Goals. And Asta is the main idea maker for the book, and she's also one of the 3 editors. And then you will hear something from a fantastic lady, Debbie Thompson. She will talk to you about bringing One Health home. And why is she fantastic? You will hear from her presentation of herself. She works with kids of different levels. She teaches kids about One Health. I have been to one of her classes and I was really amazed with what she does. So anyway, you have fantastic ladies with fantastic presentations. And please don't log off until we say so. We will try to keep it within 1 hour. I will keep my eyes on the clock. And at the end, we will have a little festive time. Okay? Let's go. Gabby, the floor is yours.
Thank you very much. And just a shout out as well to our early career group, Evan, JP and China, who've been putting together those flyers for us and helping us with the LinkedIn announcements and stuff, because today's the last one. So thank you very much to those guys for their help. So I'm going to speak to you today about chapter 14, which was a group effort. You can see all of our authors labeled there, but I've got the privilege of presenting the chapter. I'm One Health policy advisor, and I work at Unlimit Health, although I have come from a veterinary epidemiology background, so like quite a lot of it in One Health. And I think really part of this chapter is about convincing people maybe that have come from a science background, but it's really important that the One Health approach has this kind of enabling environment around it to allow people to work in that way and to implement it. And policy and governance structures that exist across sectors or groups and levels can be really varied, and they can have a huge influence on the realization of how much benefit we get from working in a One Health way. So we like to talk about the added value can deliver. So it's important, if you are going to become a One Health practitioner, if that's what we're going to call ourselves, to understand that there are different governance mechanisms and how health policy might be formed. Next slide, please. And defining governance, in essence, is really, it's the various ways that the different kind of stakeholders and groups are organized and run. And that can be both in a formal setting or an informal setting. So government with a capital G might be a particular example of a governance structure, which we'd consider to be very formal and hierarchical, top down, for example. So then if we're thinking about what policies are really what kind of set the rules or tell people what to do, like direct the behaviors and the actions of that population that they're targeted at, or the group, for example, and they tend to be agreed upon through that governance structure. So if we come back to governments as an example, these might be the laws. So the government set the law and the law then directs the behavior. And policies are developed in a policy-making process, which we like to think of is going to be a continuous process of design, approval, implementation, evaluation, and amendment. And I think some of the other previous chapters have got figures as well about the way that we design One Health projects and things. It's all very similar in the sense that we're continuously responding. It's a dynamic system. We're able to deal with things like emergent properties within complex systems and use that kind of reflection evaluation space to constantly be adapting and improving things. So that's a constant, like, it's a theme throughout One Health, and that doesn't stop with policy either. We'll also try to consider how evidence from different sources might be incorporated into decision-making as well, because obviously when we're bringing sectors and groups together, then that evidence and the way that we use that evidence to make decisions can be very different and varied between the different groups. Next slide, please. And this was just really to come back to one of the pieces of work. The reason it took us so long with the textbook was, I think, after we had decided to make the textbook, then trying to define what competencies were going to be needed by One Health practitioners in order that the book might target those to fulfill. So each of the chapters has tried to look at these 9 core competencies, which we as NEO published, and the paper is also open access and available on the website. And each chapter tried to say what competencies we would target But these competencies are the ones that sit across all of our disciplines, all of our different training and specialist knowledge, to be able to deliver on the ways that we're going to be able to implement One Health. Next slide, please. So hopefully I've convinced you that it's really important for those working in One Health that they have an understanding of how policies and governance can both facilitate uptake of One Health, but also can challenge its implementation as well. So the first half of the chapter can be read as a bit of a continuous kind of section of prose, where I was trying to focus on the understanding and the underlying concepts. So it's not really a case of memorizing facts. So this first half of the chapter tries to explain the policy-making processes and different governance systems. And then the second part of the chapter takes a closer look at the specifics of One Health. And just like the rest of the textbook as well, there's key concepts and key terms that are highlighted throughout, and applied examples which try to illustrate the points that we're trying to make in little box texts. And also we've tried to include activities throughout, and they're deliberately thought-provoking and complex. So often there's no like right or wrong answer, but what we've tried to do is include some kind of suggested discussion points to help kind of start that discussion, or give you some kind of stimulating points to think about in response to that. Next slide, please. So I just wanted to give you a bit of an example about how policy can be a really key part of what we do in One Health. And so this is an example I've used before, where we've included in the book, which is around what does Ebola have to do with the price of fish? And this is slightly oversimplified, obviously. Next slide, please. But back in 2013, if we start with the fish, there were changes made in Brussels, which is the home of the European Union, to the Common Fisheries Policy. And that arguably contributed to the largest outbreak of Ebola in history, some 5,000 miles away in Guinea, Liberia, and Sierra Leone. The Sustainable Fishing Partnership Agreement that was put in place, so that was the policy change, it allowed the European Union boats to have fishing rights in third countries, including in West Africa. Next slide. And that increase in fishing from other national fishing vessels was in conjunction with things like illegal fishing, which then depleted the fish stock. So that's where the policy is perhaps in place, but the enforcement of that policy is not in place. And you end up with the detrimental effect of the fish stocks being overfished. Also damage to marine ecosystems, and that's going to lead to a reduction in the availability of fish that was available for the local market in the coastal villages, where the fish were represented the primary source of protein for people. Next slide. So what did the coastal communities then have to do? Of course, then they had to change their behaviour, and they responded to the situation by looking to source their protein elsewhere. And often that meant people going into the jungle areas perhaps they didn't used to hunt in, and the kind of sourcing of bushmeat as an alternative to the fish protein that they were previously reliant on. And of course, as we all know, there's closer contact then with wild species, which were potential vectors for Ebola. Next slide. We've then got, it's a complex system, and we've oversimplified this scenario just so that for the example here. But there's also increasing deforestation in the Western African countries. And with deforestation, lost biodiversity, it also reduces the amount of food that's available, such as fruit, other species, for animals and also for people. So when there is a source of food, then it ends up that the wildlife and the humans are coming together more closely around those remaining sources of food. Next slide, please. And if we oversimplify that, there are obviously other elements to there, but ultimately the first case of Ebola was identified in December 2014. There was weak surveillance systems, underfunded public health infrastructure, which obviously contributed to the difficulty in containing that outbreak, and it quickly spread from Guinea to the bordering countries of Liberia and Sierra Leone. Unfortunately, 2.5 years after that, the first case being discovered, the outbreak ended, but we had more than 28,000 cases and over 11,000 deaths. Next slide, please. So hopefully you can see how these things can really have a major role within our systems when we're talking about One Health systems. And as practitioners, we might be involved directly in policy with decision makers or as advisors, or perhaps tasked with designing the governance for a One Health institution or group, for example, within a university or a government. And we want to embed that One Health approach into institutions, the principles and rules of how they're set and how those institutions are organised, i.e. the governance systems. So when policies are being created, e.g. by a government, you as a One Health practitioner might be needed to make sure that there is consideration of all the different One Health implications, or to identify the relevant people who might be involved in that policy making process. What I've tried to do in this chapter is to group these roles into kind of two sections, one being the governance of One Health, and two, the governance for One Health. So governance of One Health often concerned with how we structure the processes within One Health setting, but governance for One Health refers to how we might incorporate One Health considerations into any relevant policy or any relevant institutional's governance structure to work towards the outcomes of One Health around healthy societies, healthy animals, and healthy ecosystems, of course. So obviously, our understanding of how policies and governance is really important in terms of how we can facilitate and challenge and where the challenges might lie in terms of helping that. Next slide, please. And I do think that there is an argument to be made for why we need One Health specific governance. Not just for One Health governance, it's important for any institution or a financial structure or policy to have that functionality across sectors. And these cross-sector governance mechanisms often might not be called One Health, but importantly, they are serving that purpose to strengthen the whole system and work us towards those three outcomes that we know so well for One Health. But those traditional, narrow, sector-specific approaches in how we make policies, they can miss opportunities for increasing effectiveness, increasing efficiency in policy, or where it's been inconsiderate of other disciplines, as well as like social, economic, and cultural contexts, for example. So being able to bring One Health mindset and the way of working into all these things is really beneficial and can bring in, the opportunity to increase buy-in for new policies or to increase cost savings, for example. And getting that diversity of perspectives is already really helpful to reduce those kind of unintended impacts that might arise from any new policy that could exist. The chapter tries to touch on communication, coordination, and collaboration, because those are the 4 C's. That's our OLEP definition of One Health, you can see on the slide there. And those 4 cogs are really where I like to think about the implementation of One Health. So we're thinking about how we communicate, coordinate, and collaborate, and capacity building to a certain extent, but those 3 ones mainly across sectors. We also need to be able to work across groups, because we have lots of different groups within One Health, not necessarily just across the sectors. And then also to recognise the differences in power balance as well. So when we're talking about different levels, some might be at a very local community level, some might be at a global level. And we need all of those approaches to function across those different areas. And in terms of what governance might be suitable for One Health or encourage One Health uptake, then I would encourage you to read the chapter to be able to get a bit more information on that. So finally, just some chapter conclusions really are around kind of the enabling environment. So thinking about modifying or creating new policy and governance structures to be able to realise that added value of the One Health approach. So, sorry, next slide, please, Asta. And recognising that those implementing One Health need to be given enough decision-making responsibility or financial ability or resources to be able to effectively do what they're trying to do in bringing the sectors together and overcoming some of those inevitable challenges. Integration doesn't come for free. If we're going to take more integrated approaches, there does need to be investment of resources, financial or just goodwill, buy-in, that kind of thing. We need to be able to engage stakeholders on their own terms, making sure that you can identify things like common ground, shared objectives, how people communicate in their different disciplines, to motivate that engagement from a wide range of partners and across all those different levels, sectors, or groups. And then as One Health practitioners, we have to remain informed across a wide variety of evidence sources and types to be able to bring those together into these situations and to be that facilitator that's able to kind of communicate between the different groups and tailor those communications to your different audiences. So hopefully that's whet your appetite enough to go and read the rest of the chapter. Thanks very much.
Thank you, Gabi. That was fantastic. And I know that minds are triggered to read the chapter. So I don't see any questions burning in the chat. So shall we continue with Asta then?
Okay, thank you very much. And well, first of all, sorry for my English. It won't be so perfect as Gabby's, but I will do my best so you can understand me at least something. And of course, first of all, I would love to say thanks to Sarah, especially, and Barbara. They thought it was a nice idea to do the book and not just nah. And everyone that could be there for if in some way just to help to make this possible and to have it here. And this is our last webinar, but I hope it won't be just finished there because it's really very nice book, really nice book. It is one I expected. I needed. I did not expect like this. To say it true, it's much better. It's perfect one. So really, it's to everyone who is initiating in One Health is something needs to be read, I think. So and. Well, I'll begin with our chapter. We were people from different countries working on it, and we worked about sustainable development goals and One Health to see both of concepts, One Health and sustainable development goals. They look for the wealth of humans, but in some way they look for the wealth of the planet as a whole, but they're not really the same. And this is what we discuss over the chapter. Well, first of all, I think everybody knows on today what are sustainable goals, development goals, because they are so much colorful and you can find it anywhere and you can go into any place. You can see it written in different letters that you cannot understand, but when you see the figure, the square, you can notice, and it's very nice. It's very representative. It's very, but what do they really uh, show or tell us what they do really mean? So our chapter is organized by, I have a very first beginning as all the chapters with elevator pitch, just to see, as I mentioned, what's the idea. You can see it if you just read the elevator pitch and see if it looks interesting or not to you. And then we mark the main book of chapters we talk about in this chapter, and then One Health competencies we cover. We marked 3 of them, but I think for me the most important and most deeply developed in this chapter is collective learning and reflective practices. It's really nice to try to have a overall view of different things that sometimes we just see and look very superficial. It's like the triangle of One has the 3 circles that usually it's understood very superficially, but then it's down there means much a lot. So the same with these squares of sustainable development goals. So what we looked at the very beginning and the introduction is that different authors suggested different organization of the sustainable development goals. It's, as you can see in this picture, I don't know if you can see this picture here above, 15.1. But during the resting of the text, we followed this the framework proposed from Wage in 2015, as it is organized. All the sustainable development goals were organized in 3 levels: well-being, human well-being, middle level in infrastructure, and outer level environment. And you can see, and of course, also we used a key concept you can observe here in the book as well, in the photo, applied examples. So you can, if you read, you can perceive better or think better of what it's about, talking about key terms, and of course also activities, just as Sarah mentioned before, to make it interactive, and so you can read and try to respond, and you also have some possible response to see if you agree or not, or if you don't want to think too much, just read it and you have the possible answer. there is never one true answer. No, always there are some. It can be different ones. So this is just to make an example, and as a figure where you can see that one sustainable development goal, all his targets never will affect just one same middle level or one same level it belongs to. There's always some connections, positive, and in this case, as you can see, with the red lines, negative with another sustainable development goals that can affect in positive and negative ways in other levels. So it is really interesting to look at in depth and make a thing to change to try to understand all the system. And one of my favorites favorite examples and activity of our chapters, what I also use with my students, is this one is just to think and reflect about the photovoltaic power plants that are so well seen nowadays. And here you have very simple example that this place is near the small village in Spain, and its wall changed from the trees, almond trees. There's no biodiversity, just one type of tree, to the panels, power plant. And I always ask students, and now I ask to you, do you consider it's okay? It's a clean energy. Is that okay? That is what, just to see perception. There is no correct answer by now, but just to see and discuss. And even later, we have to think what does the tree means? Even is the same tree of the same species, it's not biodiversity, as mentioned before. On the other hand, people that gave their spaces to the company to build these panels, they receive really good amount of money. So they have higher economic level. So according to some targets of the same sustainable development goals, their well-being is better, even just on economic way, no? So there's always different things to consider. And here you can see a picture on the left, just closer there. There is also no biodiversity. And on the photo on the right, you can see different trees of electricity. So you can see one line, 2 lines, 3 lines. And before all this, there were just this one, small one. So now you can also think on all the beds and everything. So it's not just a clean energy that is very nice and is beautiful, but there is a lot of other things that goes beyond, as an example from Gabi. It came from fish to Ebola. So here you have to think and very globally and to see how it affects every time, and to think of maybe One Health and the concepts of One Health and the professionals working in One Health could help to find a solution that all the parts could be more better heard. I don't know how to explain. So, but it's really, how to say, what's the relation, a direct relation is with sustainable, well, it's very shortly, but at the last, the idea is also it's mainly on humans centered sustainable development goals. It's the relation with One Health is very close, and it's some authors indicate that it's like a first step towards the humanity to become and to get know and to care about sustainability and all our other surroundings. So thank you. Very short.
Thank you, Asta. Thank you for the beautiful example. Even though I saw it, every time you show it, I was like, wow. Okay, guys, do we have any questions? Okay, only claps for the moment. I don't see all the audience, but oh, okay. Then we go forward with Debbie. Deb, are you ready? Okay. Deborah Thompson, your floor is yours.
Thank you so much, Sarah and Asta, for having this happen today. I have to say, Chapter 16 was a mammoth of a project because ultimately it's applying all the knowledge that readers have acquired throughout the entire textbook and then teaching you how to apply that knowledge. So this particular textbook's chapter was designed in a very specific way. It's different than all the others. It is read in a narrative format. First person is singular is found in it. It's as if there's a conversation that's happening. It says I and you as if this is truly a discussion. And that was done on purpose because when it comes down to communication, it really comes down to conversations and discussions. And so with that being said, I appreciate the editor's flexibility and openness to having this different style of writing because my point of view is that when it comes to communication, it needs to sound more natural and more organic. So appreciate that. So this particular chapter is chock full of activities and anecdotes, and they are really meant to be thought-provoking and to inspire discussion. Next slide, please. As you can see, the learning objectives are as follows. Explain One Health in under 15 seconds. You might think it's not possible, but oh, it is. Navigate provocative conversations in relation to One Health. And keep in mind today, this is more like a teaser. I'm not going to go through everything that's in the chapter, but this is just a teaser to whet your appetite. Also apply knowledge from the other chapters for real life situations. I don't cover it in great detail today, but for instance, there was a rather lengthy graphic from another chapter that is brought up in this chapter, and it says, okay, now explain it in unlimited words. Now explain it in 2 minutes or less. Now explain it in 1 minute or less so that you can actually practice communication. Effectively and strategically use infographics to demonstrate One Health and converse with novice audiences about One Health, people who have never before heard the term One Health. Next slide, please. And how are we going to do this? We do this in lots of different steps, and it all makes sense once you open the textbook. Next slide, please. Okay, now I'm sure that most of us are pretty familiar with this particular 88-word definition from the One Health high-level expert panel. It's been accepted throughout the United Nations, especially the quadripartite. And so I was writing this chapter in a coffee shop in the United States, and I just started chatting with some strangers nearby, as sometimes it goes. And I asked them, could you just read these 2 paragraphs and let me know what you think? And these people, English was their first language. Okay, so that's important to know. And they are not necessarily scientists. I think one person was a computer engineer. Okay, now out of that definition, what do you think are the words that confuse people the most? Next slide, please. These are the words with the highest incidence of misinterpretation. Does any of that surprise you? And I dive into, in this chapter, the reasons why sectors and disciplines, for instance, can be confused. Oh my goodness, Sarah, I'm sorry, I did not introduce myself. So, so Dr. Deborah Thompson from One Health Lessons. I have been teaching students anywhere between the ages of 2 and 65 years old about One Health. When I go into high schools or secondary schools, sometimes we talk about the difference between sectors and disciplines. And I remember these 17-year-old students were confusing the words disciplines with like discipline, the action, penalty. So they were not, even though they were 17 years old, about to go into university, it ultimately comes down to knowing your audience, right? And then I also have been working with governments, and that's why I was also a co-author with Gabby in her chapter. Next slide, please. Okay, now the power of AI. Sometimes it's helpful, sometimes it's awful. But I asked AI exactly, I typed in a certain term that's often used with One Health. And this is the 2 images that I got from AI. Any ideas in the chat box, please? What do you think is a common term used in One Health that might be described with these 2 images? Let's see if the chat box is being used. Ooh, multidisciplinary. Thank you for that. Collaboration. Okay. Multi-level. Okay. Or domain, level or domain. And let's see if there's another one. It's good to see people are listening. This is wonderful. Okay, well, here's the answer. Next slide, please.
Yep.
That was actually about capacity building. So when I teach in universities and I talk about capacity building, one of my favorite activities is to have the students pair off. One person write down their definition of capacity building, another student do the same. And then after they're done, compare and contrast. You could do that with a lot of different terms within the One Health space. And you can see where there could be some confusion. Okay, next slide, please.
Sure.
Okay, and this is just one of many different activities that are throughout this chapter. And I have seen this time and time and time again, being one of the younger people at international One Health conferences, where you're sitting at a table at a conference and there are a lot of different languages, a lot of different cultures represented. And say if you're a new graduate and you're presenting a poster at one of these high-level events and you want to make a good first impression, you might want to do a master's with somebody at the table, or an internship, or even get a job at that table. And there's a conversation that arises at that table, and it has to do with something that you learned earlier in the textbook, like gender in One Health. And the situation in this particular scenario is that somebody's like, oh, there's a lecture about gender in One Health, I'm interested to go. And then another person at the table says, oh, pretty much that you don't really have to go, it's just these very simple things and blah, 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 right? Just writes it off. But you have added knowledge because you read the textbook and you want to, get involved in this conversation, but you have to do it in a respectful way. Keep in mind, you're the youngest by far at the table. And so you're seen a certain way, right? And it's a very delicate balance. And you might be talking to people who have very different opinions on and experiences on the topic of gender. So these are particularly interesting, slightly complex conversations that can happen in real life. So this is the type of chapter that we're dealing with, something that's very thought-provoking, something that utilizes your knowledge taken from other chapters and applying it, and then also inspiring you to go out into your community and go to your policymakers and start talking about One Health and inspiring action. Next slide, please. Special thanks to Barbara, Asta, Sarah, and Gabby and Marie, who are also my co-authors in 2 other chapters in this wonderful textbook. Thank you to Cabby, and thank you to Neo for your support. I really appreciate working with you all. Thank you.